Hello friends and welcome back to our channel. Today we're going to talk about a very important topic, understanding testicular cancer. It's important for men of all ages to be aware of this topic, which doesn't get enough attention. Even though it's a very rare cancer, young men in particular should be aware of it. The fundamentals of testicular cancer, including its signs, causes, diagnosis, and available treatments, will be covered in this video. Now let's get started. First, let's start with the basics. What exactly is testicular cancer? Testicular cancer occurs in the testicles, which are part of the male reproductive system. The scrotum, the loose pouch of skin beneath the penis, contains these tiny egg-shaped glands. Sperm and male sex hormones are produced by the testicles. Testicular cancer starts when cells in the testicle begin to grow out of control, much like all cancers do. If treatment is not received, these cells may develop into a tumor that spreads to other areas of the body. The germ cells in the testes that produce sperm are the source of testicular cancer. It most frequently affects younger men, with the age range of 15 to 35 having the highest frequency. There are two main types of testicular cancer, seminomas and non-seminomas. Seminomas grow slowly and are usually found in men in their 30s and 40s and more responsive to treatment. Non-seminomas, on the other hand, tend to grow more quickly and are often found in younger men, typically in their late teens and early 30s. Now, you might be wondering, how common is testicular cancer? Well, it's relatively rare, accounting for about 1% of all cancers in men. However, it is the most common cancer in young men aged 15 to 35. Let's talk about risk factors. What makes someone more likely to develop testicular cancer? Number 1, an undescended testicle. Number 2, family history of testicular cancer. Number 3, testicular cancer in the past. Number 4, unusual growth of the testicles. Number 5, having a Caucasian ancestry. Number 6, infertility in men. Number 7, an increase in height. It's crucial to remember that many men who develop testicular cancer have no identified risk factors at all, despite the fact that these factors can raise the risk. It's crucial to remember that many men who develop testicular cancer have no identified risk factors at all, despite the fact that these factors can raise the risk. Early symptom recognition is essential for effective treatment. What therefore ought you be alert for? Common symptoms include: Number 1, a swelling or lump in one or both testicles. Number 2, a sensation of heaviness in the penis. Number 3, a dull pain in the groin or abdomen. Number 4, a pain or soreness in the scrotum or testicles. Number 5, breast enlargement or soreness. Number 6, reduced sensation in the affected region. It's crucial to regularly examine yourself to look for any odd lumps or changes. A word of caution. Remember, this video is for informational purposes only. If you have concerns, talk to your doctor. They can advise you on the best screening methods for your individual situation, especially if you have any underlying health conditions or are on medication. If you like what you've seen thus far, please click the like and subscribe buttons and the bell notification. Thank you for viewing. Although there are other problems that could be causing these symptoms, it's crucial to see a doctor right away if you have any of them in order to get checked out. It's important to note that these symptoms can also be caused by other conditions, but if you experience any of them, it's important to see a doctor to get checked out as soon as possible. How is testicular cancer diagnosed? Your doctor will probably perform a physical examination and prescribe certain tests if you see them due to a testicular mass or other symptoms. An ultrasound, which projects an image of the testicles using sound waves, and blood tests to look for tumor markers are two examples of these tests. A biopsy will be performed to confirm the diagnosis of cancer if the tests indicate it. Among the diagnostic techniques are: Number 1, ultrasound of the scrotum. Number 2, tests for tumor markers: beta-human chorionic gonadotropin, BHCG, alpha-fetoprotein, AFP, lactate dehydrogenase, LDH. Number 3, CT scan staging. Let's now talk about the testicular cancer therapy choices. The type and stage of the cancer determine the course of treatment. It may consist of: Number 1, testicle removal with surgery. Number 2, radiotherapy, especially in cases of seminomas. Number 3, chemotherapy, particularly in cases of non-seminoma or more advanced cancers. Most men who have testicular cancer are cured of the disease, particularly if it is detected early. If treated properly, early testicular cancer has a favorable prognosis. Particularly if detected early, testicular cancer is a highly curable cancer. Testicular cancer has a 5-year survival rate of more than 95%. It is essential to have routine follow-up after therapy to look for any indications of cancer recurrence. This usually entails medical examinations, blood testing, and imaging studies. It can be difficult to live with and after testicular cancer, but help is available. Engaging in support group discussions and consulting with medical experts can provide noteworthy outcomes. Testicular cancer cannot be completely prevented. However, it can be detected early with regular self-examinations and body awareness. To wrap things up, remember, Number 1, testicular cancer is rare but the most common cancer in young men. Number 2, early detection is key, so perform regular self-exams, especially if you are in high-risk age group of 18-40. Number 3, see a doctor if you notice any unusual changes. Number 4, treatment is highly effective, especially when caught early. Remember, this video is for informational purposes only and should not replace professional medical advice. If you're experiencing any symptoms of testicular cancer, consult with your healthcare provider. If you found this video helpful, give it a thumbs up, share it with someone who might benefit, and comment down below with any questions or topics you'd like us to cover in the future. Thanks for tuning in, and I'll see you in the next video.